I'm Miranda, Riley and Shelby is videotaping, and Carly is evaluating. So today I have the patient Jamie Wheeler. I'm going to look at the provider's order and the MAR to see which medications I will be giving today and compare them and make sure that they are correct with the provider's order. So what I have here for the provider's order is erythromycin, 250 milligrams by mouth, the varicella vaccine, 0.5 milliliters subcut, and then the dexamethasone, 4 milligrams IM. I'm going to check my MAR and compare them. The MAR also says erythromycin, 250 milligrams by mouth, varicella vaccine, 0.5 ml, and the dexamethasone, 4 milligrams IM. I will be giving all of these meds at 0800 this morning. The varicella vaccine and the dexamethasone is just once. I also see here that our patient has an allergy to codeine, and I don't think any of these medications will be affected by that. So now I'm going to go to the supply room and gather my supplies. We're now in the supply room. I'm going to grab erythromycin, 250 mgs. This is the right medication and the right dose. I also have the right patient, and I'm here at 7:55, so we will administer it at the right time, and the expiration date is not expired. I'm also going to grab a cup and a little pill for my patient. And now I'm going to grab the varicella, which is 0.5 milliliters. It is also not expired. It's the right medication, right dose, right patient, and I'll be administering it at the right time. I need to grab it's subcut, so I need to grab a 3 milliliter syringe with a 1 inch needle, 21 gauge, but I'm going to change that needle because it will be dull, and it needs to be a 5/8 inch 25 gauge, and I'll be administering that in the abdomen. And then I'm going to grab the dexamethasone, which is 4 milligrams. I have the right drug, right patient, right dose, right route, which is IM, and then right time, which will be at 0800. I'm also going to grab a syringe. It will be 5 milliliters, 21 gauge, 1/2 inch, and I'm gonna grab another needle to change because of the dullness, and this is 20 gauge, 1 1/2 inch for that. The dexamethasone is not expired either, so now I'm going to go set up my supplies and go into my patient's room. We don't have a label, but what I do is I would label these with their name and their dose. Varicella vaccine, 0.5 milliliters. The dexamethasone. I have my needles and syringe. So I'm going to check again that I have the right patient, which is Jamie Wheeler. I have the right medication, which is erythromycin, 250 milligrams by mouth. I have the varicella vaccine, which is 0.5 milliliters, and that is correct with the right gauge and needle, and then that is subcut. And then I have the dexamethasone, which is 4 milligrams, right needles and everything, and that is IM. And it all checks, and I'll be giving these at 0800 to my patient. Hi, my name's Miranda. I'm going to be your nurse today. Can you please tell me your name and date of birth? Okay, we know that you have an allergy to codeine, but the medications you'll be taking are not going to be affected by that. I'm going to make sure you're comfortable and give you some privacy. I'm going to raise your bed. Rose it. Now today I'm going to be giving you what your doctor ordered you. I have here erythromycin 250 milligrams, the varicella vaccine 0.5 milliliters, and the dexamethasone 4 mgs. I'm going to start off by giving you the erythromycin by mouth. Before I administer it to you, I'm going to read you its side effects and what it is and its therapeutic effects. So the erythromycin, it's an antibiotic. It's going to treat infection proven by bacteria culture. So we would take bacteria culture, Labrazole, and some common side effects are GI complications. So I'm going to administer this to you. I have Miss Jamie Wheeler here, so I have the right patient. I have erythromycin 250 milligrams, so I have the right dose and right medication, and I'm going to be giving it to her by mouth, so that's the right route at 0800. There you go. Oh, and here's some water. Okay, thank you. And now I'm going to be giving you your varicella vaccine, 0.5 milliliters. This is a vaccine. It's going to prevent you from getting the varicella disease through active immunity. Its common side effects are chills, diarrhea, headache, fever, and there may be a reaction at the injection site, but hopefully that will not happen. I'm going to clean this. I'm going to open up my needle. I'm first going to pull the desired dosage, which is 0.5 milliliters, which is 1/2 into my gain. Okay, and then I'm going to put it into the round. And inject the air. And then I'm going to pull out maybe a little bit so that I can get the air bubbles out. I'm going to flick it. And then I'm going to push those out. And then I'm going to do the scoop method. Okay. And now I have the varicella vaccine, which is 0.5 milliliters. So I have the right medication and the right dose. I have the right patient. And I will have the right needle. But I'm going to change it. I'm going to put this in the sharps. And then I'm going to change it because it was dull once I put it in the medication. give my patient her varicella vaccine. This is going to be subcut, and it's going to go in her abdomen. Again, I have the right patient, Jamie Wheeler. Right medication, varicella vaccine, 0.5 dose, and right route, which is sub-Q. Jamie, I'm going to pull this down a little bit. So I would clean the area. I would clean the area, and then I would gonna grab some of your skin. I would insert this at a 90-degree angle and push in the medication for 10 seconds, and then hold for 10 seconds, let go and pull out. I would put the safety on, put this in the sharps. And then I'm going to give you your dexamethasone, 4 milligrams. IM. The dexamethasone, it is an anti-inflammatory. It suppresses inflammation and modification at the normal immune response. Some side effects are depression, hallucination, headache, hypotension, edema, and I'm going to administer that to you now. Gonna clean again. Pull the amount of air, which is 4 milligrams. So on here it says 4 milligrams is 1 milliliter. So I'm just gonna do 1 milliliter of air. I'm going to put that, push the air in. Push the air in. And then I'm going to get 1 milliliter. I have some bubbles, so I'm gonna lick it and get those out. Just get those. And I'm going to do the scoop method. Close. I'm going to change my needle because it is now dull. In the sharp sketching. Put my needle on. Make sure it's on there tightly. Put on my safety. And I'm going to check again that I have the right patient, Jamie Wheeler. I have the dexamethasone, 4 milligrams is IM injection, so it's going to go in vastus lateralis. Pull this down. And I'm giving this at 0800. So what I would do for vastus lateralis is do a tic-tac-toe. So I would draw a tic-tac-toe, and it would be the lateral middle box. So I would inject it right here and clean that area. And then on my needle, I would push the skin out of the way so I could get to the muscle, and I would inject at a 90-degree angle, insert, push for 10 seconds, hold for 10 seconds, let the muscle go, and pull out. And then I would put the safety and put it in the sharps. Now that I'm done with administering medication to the patient, I would just make sure that they're comfortable and okay. Ms. Wheeler, make sure you have your collar. You can need anything, just let me know. Put you back in a comfortable position. And be back to check on you in about 10 minutes. I'm now leaving my patient's room, and I'm going to go document the medication I gave. It's okay. So I have given erythromycin at 3:24, the date, the varicella at 3:24, and the dexamethasone. I gave all of those at 0800. Going to put my initials, sign, and then the erythromycin was by mouth. The varicella vaccine was on the left. No, it was in the abdomen. The right abdomen. Quadrant. The abdomen. And the dexamethasone was in the vastus lateralis, so the right thigh. And then that would be all for my documentation.